A big welcome to everyone. I am seeing some familiar faces and some new faces. So those of you who don't know me, I do come from a yoga therapy background. So what I am going to talk to you about today is based on what is fact scientifically. I will also be looking at the alternative approaches to coping with this journey of menopause. And if there are any questions, I would appreciate if you could hold them till the end of the session, because there is a lot that I want to go through with you, and I want to make sure I go through that, and I'm sure you'll find a lot of your answers. But if there is a burning question and you cannot hold it, please, yes, do ask, okay? Before we start, I'm going to just share my screen. So let me do that first of all with you. And just bear with me for a moment. Okay, just a second. Okay. I don't know whether you can see my screen. Yes?
Yeah, we can.
Yeah,
That's
you can
great.
see my screen now. Okay, great. Takes me a little while around technology too. Okay, so a huge welcome to everybody, and it's really lovely to see that we've got quite a lot of people who have joined us today, because had I known what I know today, I would have done a few things slightly differently and taken more care of what I was noticing, that the changes that my body was going through. So some of you may be at different stages. I hope that this presentation will help each and every one of you throughout whatever stage you are at, okay? So I want to say, first of all, that this journey is a journey that is to be welcomed, because it's a journey that happens to every woman who is born biologically a woman. No matter what happens, we all go through this journey. So let us welcome it with open arms, because it is going to happen. It is going to come whether you like it or not, okay? Oh, why is my screen? Right. So I want to start with a quotation that when women thrive, all of society benefits, and succeeding generations are given a better start in life. This is by the previous UN ambassador, head of UN, Kofi Annan. And we've seen this happen time and time again in various countries, especially when the women are brought forward, there are many multiple changes that are seen. My presentation today is going to cover what is menopause, why does it happen, what are the physical changes and other changes in the body, what are the symptoms, and what treatments are available. I am not a doctor. I come from a yoga background. So on the medical side, if you are seeking help, your first point of call is always going to be your GP, okay? So let's start with what is menopause. As I said, it's a natural process. It's gradual. It happens. It's an aging process. It happens to all of us women. It happens on our own time. Some of us go through it a little bit early. Some of us can go through it a little bit late. Some of us go through it at the time that we are meant to go through it. Essentially, it is the mark of the end of your reproductive years, when you no longer have a period for 12 months and you're aged 40 and over. Bleeding stops completely in the absence of any medical or surgical interventions. So that is what essentially menopause is. And you see, I've put a little caption over here to show you that it's a journey to be celebrated, not to be worried about, okay? What are the factors that affect at what age we can get menopause? So certainly number one is your genetic factors, depends on what runs in the family, okay? Also your diet, if you maintain a good and healthy diet, your cycles are likely to be longer. And if you maintain a poor or malnourished diet, your cycles are likely to be fewer and you're likely to hit early menopause. It also depends on whether you have any addictions, such as smoking, drinking, drug abuse. Anything done beyond moderation can have an impact on the quality of your ovum or the egg, and it can affect the number as well as its release. And again, it can affect whether you go into early menopause or later. Also, if you have any kind of surgeries that can kickstart the menopause earlier, if you have had cancer and cancer treatments, that likely can set off the menopause much earlier than it normally would have occurred. There are studies and evidence that shows that obesity also can delay the occurrence of menopause, and the higher number of children that one has can also delay the cycle. Okay. The story of menopause is to do with our hormone called estrogen. I've written both the ways that you might come across its writing, with an O or with an E. The E is the American way, the O is the English way, so not to get confused about that. It's exactly talking about the same hormone. You can see that it peaks during a woman's lifetime at the age of about 35 and then begins to fall down. So with it come a number of changes, and the menopause age is between 40 to 60. That is the range, okay? As we know, with averages, things can always be a little before or a little bit later as well, okay? So we have to bear that in mind. So it is essentially the journey of what is happening to your estrogen, the hormone level there. Now, why does it happen? So during your reproductive age, when you are ready to ovulate, the messages go to the brain sends the message back to the ovaries to begin the menstrual cycle and release the hormone. However, women come with a limited stock of eggs or ovum. So as that gets depleted, then the signal going to the brain or coming from the brain also reduces accordingly. So the amount of estrogen reduced also continues to go down. And when that happens, there are numerous changes in your body that take place. There are various stages to our journey. The first is the premenopausal stage, where you have, once you start your menses cycle, everything goes on a regular basis. The time when you start an irregular period on a regular basis. So you can have, during the premenopause phase, sometimes stressful situations can also cause an irregular period, but we're not talking about those situations. When your period becomes continually irregular, that is when the perimenopause stage sets in. When you have your last period, that is the menopause stage. And then begins 5 years after that menopause stage begins your post-menopausal stage, which is where you're going to be for the rest of your life. Okay, so again, you can see it's all related to what is happening to the estrogen levels, becoming very high initially, then becoming a bit more irregular, and then falling down, and then staying at that low level. So we're going to look at what happens at the perimenopause stage, because that is the first stage of menopause. There are a lot of physical, psychological, and sexual changes that begin at this period. It can happen 8 to 10 years before the actual menopause sets in, and it begins with the onset of your first irregular period, usually in your 40s. Now, And this period lasts until you hit menopause, the point when your ovaries stop releasing the eggs. At this stage, you can experience many menopausal symptoms, especially in the last 1 to 2 years when the drop in the estrogen level begins to accelerate. You still have a menstrual cycle during this period. You can still get pregnant during this period, but what happens is that the number of days of your period can lengthen or shorten. The amount of bleeding can become light or heavy, and you can have that happening on a regular basis. For some people, what happens is that you have a mostly regular cycle followed with a few interruptions. For instance, your period may come 15 days early, or it may be 45 days delayed, and then you hit menopause. For some, there is a late transition because the gap between the cycles becomes a lot longer, over 60 days, and that takes you a little later towards the menopause phase. The most important thing during this time is that if you hit a situation where you have excessive bleeding for a number of days, then it can considerably deteriorate the quality of your life, because there is no time for the blood to be replenished that you are losing. Your hemoglobin levels drop. There's a tendency to feel very tired, as if we don't feel tired during a regular cycle. So it can adversely affect your work, your home life, as well as your social life. And sometimes HRT, hormone replacement theory treatment, may not work in this circumstance. And in the extreme case, it may lead to a hysterectomy. Okay, so these are the things we need to be aware of when our period becomes irregular, and we're noticing a lot of changes in the body. And these changes I will talk about in more detail a little later. So once we pass the perimenopausal stage and we hit the menopause stage, which is when you have no periods for 12 months, your estrogen levels have dropped, the endometrial lining of the uterus has become very thin, there is an impact on the size and quality of your ovum. And another way of judging whether you have hit menopause is looking at what we call the FSH levels, the follicle stimulating hormone levels. They start off being normal, and then they become variable during the perimenopausal phase, and then they go high during the menopause phase. Okay, so this is just to give you an indication what is happening when you are entering the menopausal stage. It is natural when it happens above 40 years. It is early if it happens below 40 years, and it is late if it goes beyond 55 years. Okay, again, these are averages. Things do vary around the average. Now, post-menopause, as I said, is what we experience for the rest of our life. And for a woman, almost half her life can be in this phase, or at least a third of her life. Okay. During this period, sometimes the menopausal symptoms will continue, but sometimes they can also begin to reduce. And as time goes on, they do become less and less. However, because we no longer have the amounts of estrogen in our body, women are prone to increased risk from osteoporosis, heart diseases, and cognitive impairment. Now, looking at this from an Ayurvedic perspective, which is a sister science of yoga, and it goes back over 5,000 years, the same information, they look at it in a slightly different way. So it looks at the first 5 years after menopause is what we call Pitta dominant. Pitta is a fiery constitution, and the elements here are fire and water. Okay. So I'm using these different terms in the hope that something somewhere resonates with someone. Okay. Now here, the symptoms which can be dominant are the fiery symptoms such as your hot flashes, the night sweats, headaches, urinary infections, burning sensations, you have acid reflux, you can have very vivid dreams during this time. It can also lead to prolapse uterus, bladder, as well as incontinence. The next 5 years are what we call Vata dominant, where the elements are space and air. And here the symptoms vary and they change to becoming more related to aches and pains, where one may experience dryness of the skin, of the hair, of the eyes. Arthritis may begin to set in, osteoporosis may set in, coronary heart diseases where you experience palpitations or racing heart. Sometimes it could lead to an increased risk of stroke as well as cognitive issues. Okay. These are symptoms. Not everybody experiences all of them. Not everybody experiences them to a great intensity. The intensity varies. The amount of symptoms you experience varies. It all depends on how you have looked after yourself. Okay? And even when you do experience these symptoms, there is a lot that we can do to help ourselves during this phase. After all, our bodies were made to cope with this, so we also have coping mechanisms. Now, as I mentioned, there are many internal changes that are going through in the body with this decline in estrogen. There's a lot of thinning, there's a lot of drying happening over here, and a lot of loss of elasticity. So our uterus is becoming smaller. The ligaments in the uterus are becoming more lax. So as I am telling you all these things, I want you to visualize if this is happening, what kind of problems this could lead to, okay? The endometrial lining of your uterus is becoming thinner. And as I mentioned earlier, the ovum or the egg quality, the number is shrinking, the quality is also reducing. The vagina is becoming narrower, drier. The pH scale is also changing from alkaline to acidic. The bladder has less protection and hence it is prone to more infections. So these are things that are happening naturally to every woman, okay? So we now come to the signs and symptoms of menopause, some of which I have already shared with you, but now I'm going to go through them in a bit more detail. And as I go through them, we can also see that there are a lot of things that we can do for ourselves too. Now, I've gone through these slides a little quicker than I thought, which is great, which means we have a lot more time for questions as well. So at any point you do want to ask me anything, please feel free to do so, okay? So the first symptoms that you can experience in your perimenopausal, starting from the perimenopausal stage, and remember that is 8 to 10 years before you hit menopause, are your vasomotor symptoms, or what we call the pitta dominant, where fire and water are the dominant elements here. So hot flashes, they can vary in intensity, in length, and in frequency. You can experience night sweats or cold flashes, headaches. They can be an increased body odor here. Now, as you look at these symptoms, I am sure if I were to ask you all, what can we do about them? There will be many answers coming. So I'm going to give you a few minutes to just think about it, that if you or your friend were experiencing this, what would you guide them as to what they could do about it? Just going to give you a couple of seconds to think about that. So since this is an online session, and I can't see all of you, I am going to let you hold your answers in your head, and hopefully some of your answers are what I have got over here, okay? So you can always keep cool. These sound very simple things and very sensible and logical solutions, but that is all that is required. As I said, this is a natural phase in a woman's body, so the tools available for us to deal with are also very simple, okay? So you can keep be careful of the clothes you're wearing, comfortable, cool, cotton clothes, loose clothing, keep the bedroom cooler, have cooler showers, eat cooling foods, drink cooler drinks. And you can also, if you have any headaches, you can take medicines where they are required, use deodorants, use powders, and most importantly, you can do the right kind of yoga. I cannot emphasize that enough, because I have many people who come to me and say to me, Sangeeta, but I have been doing yoga and I'm still suffering. And then my question to them is, what kind of yoga are you doing? And the answer is hot yoga. If you are experiencing hot flashes and you're experiencing night sweats or you're experiencing headaches, do you think hot yoga is the logical solution to dealing with it? Thank you for shaking your head. No, if you did so, because it is a logical way of becoming aware of what you're experiencing and then dealing with it accordingly. Just because yoga is good for your health, it doesn't mean you go blindly for any kind of yoga. You need to question yourself, what is it that your body requires? Am I giving my body what it requires, or am I adding to the woes of what my body is going through? Because my body is going through what it is going through since there is a change in the hormonal level. How can I help it cope with that change? Yes? Okay. The next change that you can experience with the vagina becoming drier, there is, intercourse will become painful, can become painful. It is more prone to infections. There may be a change in your libido. There is also decreased fertility happening. So at this time, it is really, really important to have that conversation with your partner, to communicate with your partner. And again, I give you a couple more minutes to think about what else you could do over here. And if there is something in my list that is missing, please feel free to unmute yourself and do share in the discussion. Okay. So I have here, communicate with your partner, use creams, and gracefully accept the changes that are happening in your body. Okay. There also is a change in our breasts. There is change in the way we feel, in the way they look, in their sizes, and all that. This is a good time to get refitted, to get going with your exercises, and again, to gracefully accept. Sometimes it may be to your benefit, so just gracefully accept the changes that are coming through. Okay. Yeah, there's a lot we women go through. There is never a steady stage. Sweet cravings go up. I know for me, sweet cravings have gone up tremendously. So here is where you have to watch your diet. You have to make sure you nourish yourself regular intervals, so that you are not just reaching out for refined sugars, because that again will then have a further knock-on effect on your weight and on your mood. So it's a good time to start planning your meals and your snacks a little bit more, so that your sweet cravings are taken care of naturally. And if you have enough sweet cravings, if you're giving yourself proper carbohydrates, it can also deal with those sweet cravings. Okay. I've noticed the days when I'm not eating properly, that's when I am grabbing whatever comes into my hand. But if I am having proper meals, I do that less so. And I'm sure many of you notice that yourself too. And as carers, so often we forget to look after our needs. We're so busy looking after someone else's needs. But it is time to take stock and say, you are important, because when you take care of yourself, you can give more of yourself also. Okay. So I have here healthy options. And as I said, if we don't take care of our sweet cravings, it can add to the woes that come again with menopause, of some changes in our weight, especially around the belly, hips, and thigh region. Okay. Here, exercise and diet again play an important role. I know there are many things, many variety of exercises that are available, and many kinds of foods that are available today. So it's, again, good thing to plan. Before I go to the next slide, is there anything anyone wants to add here? No, everything's making sense? Yeah? Okay. Right. Carrying on, there are plenty of symptoms and signs that we go through. With the loss in muscle tone, we can have a prolapsed uterus or a prolapsed vagina or bladder or the rectum. And for this, again, we have yoga, Pilates, Kegel exercises, and lightweight exercises are recommended. So often we hear that women should introduce weights in their exercise regime. So if you haven't already done so, please do that. We're not looking to build big muscles, but we're looking to retain muscle tone and to avoid these prolapses from occurring very deeply. Okay. Please remember that as I go through these signs and symptoms, it is not the case that it'll happen to everyone, and it is not the case that you will experience every single thing. It may be just one or two things you experience, but it is good to be aware of what is in store, okay? As I mentioned, incontinence also becomes an issue over here, stress and urge incontinence. Also, since the pH is changing, we are more prone to UTI infections, to burning sensations. Here, please do go to your GP, hydrate to flush out all the infections, strengthen the muscles. Kegel exercises help, yoga helps. Use pads, special underwear that we get. And on your diet side, you can reduce spicy, sour, salty foods, caffeine, fizzy drinks, alcohol, citrus juices, refined sugars, and drinking before bedtime to help you. Okay. And start to enjoy cranberry juice, wear comfortable clothes, take over-the-counter medication which provide relief, but they do not necessarily treat. Okay. And use a hot water bottle as and when you need to. So as I said, the symptoms are there, the signs are there, but also they are very logical and simple solutions to looking after yourself. There are also changes in our skin and our hair. Things begin to become drier, they lose their elasticity. You start noticing more wrinkles as the estrogen levels drop. There is also hair loss. You may notice your heels cracking a little bit more. There is change in skin tone. Acne may come back again. There may be dry eyes and dry mouth. And some people may experience male pattern hair growth. Okay. So again, go to your GP, go to a dermatologist if you need to, get yourself recommended to a hair specialist if you need to. In our tradition, again, in Ayurveda, oil massages are recommended, particularly with sesame oil and gingerly oil. These are recommended. Please go for your beauty treatments, foot reflexology, pedicure. And in Ayurveda, we have a treatment called Shirodhara, which is pouring oil on your head for half an hour. If you haven't tried it, please do. It's extremely therapeutic, extremely relaxing, and very nourishing for your body. Okay. Abhyanga is called a body massage. So when you do have a body massage, try and have it with oil, because that will also lubricate your joints and it will also help you with the dryness of the skin. There are many, many emotional changes. You might find yourself bursting out in tears, crying for no reason whatsoever. It is perfectly normal. This happens to a lot of us. It is again the sign of, just the hormones in your body changing. Please speak to your partner about it, speak to your children about it, educate them as well, because the more they understand you, the less likely you're to have discord in family dynamics. You can also experience mild depression. You can have strange and vivid dreams. This is all part and parcel of this. But recognizing these, accepting these, talking about it helps the journey through this phase. Join support groups where you can. Do not abandon your girlfriends. This is the time to ring up those girlfriends you haven't called up, continually meet up with them and form your own group, form your own self-help group over here. Do what you enjoy, cultivate new hobbies and interests, look after your food, eat more fresh food rather than refined foods and processed foods, okay? Osteoporosis and fractures also become part of the scene. And sometimes when we have an accident, that is when we become aware that osteopenia has set in and the bones are not as strong as they used to be. There are many things you can do here too. There is a allopathy medication for it. Alendronic acid is one of them. You can also do lightweight exercises, change your diet, introduce some supplements. The ones that I have found interesting from my research is moringa, celery juice, black raisins, and figs, which also keep your gut clean. Small amounts of protein, calcium, and vitamin D supplements are essential. So I find that, these are the things that you can do for yourself. And with more research, you can find out more things if you are inclined to do them naturally, what you can do to help yourself. And if anybody wants any further information on this, I can also give you the recipe for a powder, a homemade powder with herbs, okay? It's an Ayurvedic powder. So if anyone wants that, please let me know and I will send it to Marie. Cardiovascular irregularities also can crop up. Hypertension, anxiety, palpitations in the heart, racing heart. I know that for my own self, I have begun to notice an irregular heartbeat at times. And thankfully, my yoga practice is helping me with that. So again, diet, exercise, regular walks, keeping yourself relaxed, listening to something relaxing, be it music or watching a nice movie rather than a violent movie, less listening to news, yoga and meditation, all are tools to help you during this stage. Irregular periods, as we are going through the perimenopausal phase, it can worsen your PMS symptoms, and it can also cause the bleeding to change. So here again, get in touch with your GP. Yoga helps to regulate the mood. It helps to also, to some extent, regulate the hormonal balance. Your diet is also critical, and adjusting your daily routine depending on what you are experiencing, okay? Other changes that you can experience include joint and muscle aches and pains. For this, we have the turmeric drink, which you mix with milk. You add a little bit of pepper and a little bit of coconut oil, heat it, warm it. When it gets to a point where you can drink it, at that time you drink that. If you do that every night, you will also have a great sleep. This is a recipe and a remedy that has been passed on to us from generations on. Turmeric latte and all that has become popular in the shops only recently, but this is something that we have, which has been part of our tradition for a long time. A hot bath helps. Sadly, many people I speak to have got rid of their baths and have introduced showers in their homes. So no problem. Get a hot towel, place it where you feel the aches and pains, add a little bit of magnesium oil in it if you need to, or Epsom salts, and place it on there. That helps, along with deep heat and again, gentle yoga. Cognitive factors, we have so many things to help us over here. Many games, Sudoku is very popular. There are many quizzes. Cultivating new interests and hobbies. Yoga could be one of them as well. So many things to occupy you, exercising your mind muscles. They are also muscles at the end of the day. So reading, learning new things, singing, chanting, all that helps. Digestive issues, you can experience bloating, indigestion, and constipation. Over here, your diet and yoga can be a big help. You need to watch what you're eating, what you're drinking, and you're not mixing too many things at one go. You need to also look out for, in case you cultivated allergies to something like wheat. You may have been okay earlier, but you can cultivate intolerances over time as well. So it's a good time to just check up on things like that. Tinnitus, so itchy ears. Here, again, go to your GP. Make sure you're relaxing and not panicking, because that also helps the healing journey. There are changes in cholesterol level. Diet plays a big part here, as does exercise. And as always, remember, these are hormonal changes. These are symptoms. They can be intense or mild, and they can change over time. Now, the HRT that is available, please check with your doctor if you are planning to go down this route. I am only giving you simple information. It is a much bigger field, which your doctor can help you with more on. There are mainly two types of hormone replacement treatment, and generally when you are in the perimenopausal phase, they are most beneficial. Okay, it can be a combined HRT with both estrogen and progesterone for those who still have their womb and uterus, or it could be just the estrogen for those who have had a hysterectomy. This estrogen is available in many forms. It comes in a tablet form, a patch, or an implant, or it can be in a gel and a spray form as well. So there are many different options. This is why it is important for you to talk to your health expert and your GP as to what is most appropriate for you. You can also have a progesterone is available. It can be combined with estrogen in tablet form or in patches, or it could be available separately as a tablet or as a coil. Now, there are associated side effects and risks with this, with HRT, but again, they can vary. And I know that every so often there are studies that come out showing that the risks have reduced or something better has come through. So it is always good to check what is available latest. Now, these are the associated risks. You can experience fluid retention, bloating, headaches, indigestion, depression, breast tenderness or swelling, or vaginal bleeding. And the risks are certain types of cancers, deep vein thrombosis, blood clots, and strokes, gallstones, blood clots, and strokes. Now, as I was going through the different symptoms of menopause, I concurrently also told you what are the things that you can do. So we look at those things again, starting with yoga. So HRT is one form that is available to you on the allopathy side. So again, that is something you discuss with your GP and your healthcare worker. On the other side, what you can do for yourself, yoga, as I said, is a holistic lifestyle. It's not just a set of physical exercises. It's an entire thing about how your mind functions. It incorporates diet, exercise, and mind-oriented practice, which is nothing but meditative practices. Okay, there are many studies that have been done and support the role of yoga in showing that it brings a reduction in cardiovascular risk. It improves sleep quality. It reduces anxiety and depression. It helps in pain management. It improves your cognitive functions, and it's an effective tool in coping with biological transition and a complementary and alternative healing system. I have put it in red, right kind of yoga. So please remember that, okay? It has many, many components. Your asana practice, the physical postures is one, the breathing tools are one, visualization is the other one, chanting is another one, meditation is another tool, and there are many other tools in yoga that are offered, okay? It improves your flexibility, it increases your range of motion, your coordination, it reduces the stiffness and pain in your body, and it improves the lung capacity. On the psychological side, it brings calm to the mind, it stabilizes the mood, it increases energy, it enhances your alertness, it improves concentration and brings emotional stability. It also fosters a more positive body image and positive thinking, and it supports acceptance of the changes that your body is going through. The other things that we have mentioned include your diet. And as I said earlier, avoid triggers such as spicy, sour, salty foods. Reduce or quit caffeine, alcohol, and smoking. Add plant-based foods, which are rich in estrogens such as soya, chickpeas, lentil, flaxseed, grains, fruits, and vegetables. Lifestyle changes. So diet and lifestyle can take care of most of your symptoms that you will experience during your menopausal stage. So have a good routine, both for your daytime as well as the nighttime. Have a weekday routine, have a weekend routine, have a sleep routine, and incorporate massage in that routine. A massage could be a simple thing before going to bed. Keep some cream near your bed. Use that cream, massaging your foot gently, your hands, and the tips of your ears. You know, your earlobes are the shape of a fetus. If you massage your earlobes, it's connected again to every part of your body, as is your sole of the foot, and your fingertips are connected. They have 3,000 nerve endings in them. So if you're stimulating those, you are effectively giving your whole body a massage, okay? So you can use a cream, you can use sesame oil, sesame oil is also called gingerly oil, okay? And as I said, in lifestyle, you can also cultivate interests and hobbies. Make sure you are journaling your symptoms so you understand what your needs are better and you can cater towards those needs. If you are experiencing hot flashes, keep the room cool and keep your clothes also that are comfortable both daytime and nighttime. Exercise is an important part of your lifestyle. Please be gentle and kind to your body. You need regular, gentle, calming kind of practices, including yoga, that help to reduce those aches and pains and help you to sleep better and help to elevate your mood and reduce the anxiety. Support groups can come in the form of meeting up with your friends, meeting up with your girlfriends, sharing what you're going through. You will notice each one will have something to say on this topic. Each one will have something to share. Educate yourself. There is plenty of information on the NHS websites. Check in with your GP surgery as well if they have any information that will help you, because the more you understand what you are going through, the more you can help yourself. Any prescribed medication, over-the-counter medication that can help deal with your symptoms, do not be afraid to take them. If they help you to have a better quality of life, especially, please do not hesitate to do that. There are many alternative therapies available as well. Don't be shy of finding out about them and seeing what works for you. Each one is different. What resonates with one may not resonate with another. So find out what works for you. Everything is individual because your journey is also an individual journey. Okay, I'm going to end here, just showing you this slide. Some of the symptoms I may not have covered, but I will share this slide with Marie